Our next guest wants your kids to love brushing their teeth. She makes dentistry fun. We are thrilled to introduce Dr. June from Knightsville Pediatric Dentistry.
This is Charleston Women Podcast, where you can meet like-minded, strong, independent, professional, and inspiring local women. This is Charleston Women Podcast.
And now I am thrilled to welcome to the Charleston Women Podcast, Dr. June Maracaro McCullum of Knightsville Pediatric Dentistry. Dr. June, thank you for joining us.
Thank you for having me, Erin. Thank you.
Yeah, so we've got, I know we're going to do some fun stuff. You're going to do a little teeth brushing demo in a second. So I'm going to tease ahead to that. But first of all, I love meeting successful business owners like yourself and hearing your story of how you started. So I'm just always curious, did you want to be a dentist when you were a little girl? Is this where you envisioned yourself?
So my vision when I was younger, I mean, you can notice from my accent, I'm from Africa, I'm from Kenya. And when I was young, my first dream, I wanted to become a physician. I wanted to become a pediatrician. That was my first thing, because I remember seeing the missionaries coming to Kenya, and I just loved how they were interacting, with the locals. And I also loved working, with children. And I was like, you know what, when I grow up, I'm going to be a pediatrician. Yeah. And things changed when I graduated high school. I started getting exposure into dentistry world, and my focus changed from, the medical world to the dentistry world, and that's why I'm here.
Yeah. So where did you grow up in Africa?
I grew up in Kenya, in a little town down in Mombasa. It's by the Indian Ocean. It's a little island by the Indian Ocean.
I mean, I've never been, but I bet it's beautiful.
You're welcome. We're really close to Zambia, Madagascar. Everybody talk about, Madagascar.
Yeah. So what brought you to the States? When did you move over here? And how did you end up in South Carolina?
That's a long story. Okay. So I came to the United States in 1995. I was 19 years old, just out of high school. And as I said, started in dentistry and applied. I mean, everything just went well. Went to the embassy, got my visa, applied to the school, got accepted. I mean, I did all the exams, to see I qualified as a English speaking, and I was ready to attend college. Everything just fit well. Ended up in Alabama in 1995. Went to undergrad in Alabama, got married, moved to Georgia, ended up going to dental school in Georgia. Okay. And then moved further east to South Carolina.
Yeah, and here you are. So where do we find you in Knightsville? For folks that are from there, describe to me where your office is, where we can find you.
Okay, I am on Orangeburg Road. I'm 852 Orangeburg Road. I'm right across from Knightsville Elementary School. Okay. So pretty much when you come into Knightsville, before you get to Central Avenue, where you have Publix and the gas stations, I'm right on the right-hand side.
Well, that is convenient and good for business, being across the street from an elementary school, I would imagine. So let's dig in. I think a lot of people probably don't like going to the dentist, right? I'll speak for adults. A lot of time, you know that. I'm not telling you anything you don't know. You're very lovely, right? Like not my favorite thing to go to the dentist. But as a pediatric dentist, you guys do such a good job of making it fun for the little ones. So what are some of the things that you do to make them excited to come and excited to return in the future?
So one of the big things we really try to do as a pediatric dentist is to know the patient. In our questionnaire, we ask what are the favorite things the patient likes to do. Do they have a favorite toy? Is there a favorite movie they like? Do they have pets? And when they come to the office, we try to talk to them, talking about what they love. If there's a favorite movie they love, we play movies in the office. So we play a movie, and we have stuffed animals around the office. If there's something they like to hold while they're on the chair, they can do that. And then at the end, they get goodies, kind of like that encouragement. And also we get a sugar-free lollipop. So we try to make it comfortable for them. And we don't push them through the procedure too. If we have a child who's coming in and they're still trying to acclimate to being on a dental chair, we do have a baby room in our office where we can put the little ones in. Yes, there's no dental chair in there. There are a lot of toys, like a little play area, and they can play until they get comfortable about about being in the dentist.
That's wonderful. I know with my kids, they went to their first dental appointment. I think it was 1. Is that still correct? That's what age we should go? Okay.
Yes. According to the American Academy of Pediatric Dentistry, we recommend by 1. Even as soon as the first tooth come in, we also encourage them to bring them to the dentist.
Even if they have no teeth, still come in and check things out.
You know what? Even they had no teeth, because one of the things we look for when they have no teeth, we talk about feeding. The tongue has a lot of influence in feeding. So one of the big things we do in our practice, we do tongue tie procedures. So if you want to bring a child in for an evaluation, if you're having a hard time breastfeeding, we can be able to help you too.
Yeah, that's great that you offer that. As you're talking, I see the flash of the toothbrush. So I'm really excited for this portion. I know a lot of people are listening to this podcast, but you can also go online to the website and you can watch this later, because you have a stuffed friend who is going to help do a demonstration of how children should brush their teeth, or I should say how the parents should be brushing their children's teeth, correct?
Yes, yeah. So one of the things is, toothbrushes come in different sizes. We have like the little ones. I love this one over here. It has like a little handle to it. Oh, nice. So the little children can put their fingers and kind of have a nice little grip. Yeah. And another thing I recommend is round. So if you're teaching your children how to use a toothbrush and they're putting it in their mouth, they don't injure themselves. Compared to just a regular toothbrush, which is skinny and long, they can injure themselves in the mouth. Yeah. So this is medium. Yeah. So you can see this one. And with little ones, I recommend a little smear of toothpaste. If you're going to use toothpaste, a little smear, because you don't want them to swallow too much toothpaste.
Gotta love Mount Pleasant magazine. It's all about Mount Pleasant. It has important people inside. I'm Jeff from Lola. We just opened in Mount Pleasant, and we love Mount Pleasant magazine.
You're listening to the Charleston Women Podcast.
What is your friend's name that's going to have the cleanest teeth?
My friend is Mr. Lion. He wants to say hi.
Hi.
Yeah, he has very big teeth. Just ignore them.
His teeth are beautiful. You've done an excellent job.
Thank you very much. Yes. And he's very patient with me too.
Yeah.
So one of the things I always recommend when you brush the kids' teeth, start from the feathers in the back on the top and come around, kind of like stick with the same motion. Don't forget around the tongue area, on the top, and also towards the cheek. You can make it fun. There's so many kind of toothbrushes out there, different colors. Some of them come with games in them and timers. Remember, you need to spend about 2 minutes brushing their teeth. Okay. So you can make it fun for them too.
Okay. And that's the same for adults, right? Still 2 minutes?
Yeah, 2 minutes also for adults. And also don't forget flossing.
Don't forget flossing. I know. Is it true that flossing extends your life?
Yes, it can. You know why?
Why is that?
So flossing is obviously to help cavities, but the big thing about flossing is your gums. Your gums. You need to make sure you have good periodontal health. Yeah. Your periodontal health is connected to your heart because of all the bacteria in your mouth. So that's the reason why we encourage people to floss more often.
See, I never knew that. I just knew they would say you'd live longer if you floss, but I was like, why? Why? I do floss. I'm going to do some extra flossing tonight, though, just because of you, Dr. June. So thank you for your teeth brushing demo for the kids. My next question, I guess, is at what age as parents, do we stop doing it and do we allow them to do it? Because I think it was my youngest, you know, he'd get tired and lazy. I think I was like, you're good. And then the next trip to the dentist, she had cavities. And I was like, oh, this is totally my fault. So don't screw up like I did. What do you recommend?
My recommendation is if they can start tying their shoelaces by themselves, they're ready to start brushing by themselves.
Okay. So I did that. She just didn't do a good job. So how do they can tie the shoes. So that's like right around kindergarten, right? They're brushing their own teeth. Do we go back and check? Like, how does this workflow happen?
Please do. Make sure you go back and check on them. Because one of the things kids want to do, I love my children a lot, but they want to be the fast, and they want to be done as quick as possible. Right. So this is what they do all the time. All done. So they forget the back areas. So that's when I always tell parents, please go back and check on them. Make sure they get all the way to the back. And especially with the manual dexterity of their hands to go to the back, that's what most kids usually miss, going to the back areas.
Okay. And then, so we've moved from babies to like they can finally brush on their own. At what age are you seeing that you're sending them off for orthodontic care? I feel like that's happening earlier than it used to. Is that true?
It's true.
Yeah.
So one of the things I'm seeing a lot of children now is going to orthodontics around 7 years old.
Wow.
And we usually recommend to get your first orthodontics evaluation around 7 because that's when you're starting to get the front teeth, the adult front teeth. But one of the big things that most children will probably need care at the beginning is when they have an underbite. When they have that kind of bite, because you can help stop the growth maybe by wearing like a headgear sometimes, or if they're very crowded and they kind of like is a cosmetic concern to the child, they can start braces early. But with the American Academy of Orthodontics, they recommend by 7 to get their first evaluation. But I know when you have those things, with me, especially with anterior crossbite, I tend to refer them a little bit earlier.
Right. And I love, you're solo private owned practice. So I feel like that's what truly makes you special instead of a big one sometimes, or maybe you feel like a number. We're really getting that personalized care with you and your staff.
That's what we try. And I think every office has their own philosophy. I used to work in a bigger practice before I went to my solo practice. And I think it also depends on the doctor and the flow of the practice. But for me, being solo, I tend to take things personally to me. They are like all my children, so I like the one-on-one, relationships I have.
Of course. At what age do they stop seeing you? Is it 18 or sooner?
Well, that's to be.
I feel like I just asked a loaded question. If you can't see her face, she's making all kinds of faces.
Yeah, I know, because I would love to graduate them at 18 years old, because at that point I felt like you're about to go to college. But I do have some college kids who don't want to live a pediatric world.
Look, you're very likable. They enjoy you. I don't blame them.
Yes, I have several of them in there. And some of them are also like studying the military. But I usually recommend by 18, they need to graduate to an adult dentist.
Okay.
But as I say, it's debatable, especially because I'm a solo provider.
Yeah.
I can make decisions if I want to keep them.
Yeah. At 35, you're like, you have to go. You're bringing your own children.
I know. Yeah. We usually try to do a graduation for them. Right. I mean, we do a gift kind of like, hey, go to the real world. And then they turn around. I can come see you, Dr. June, again. Yes.
How can you say no? I kind of think that leads me to my next question. Working with children, I'm sure there are tough days where you're exhausted and tired and things don't go as planned, but there's also probably so many days filled with so much joy. What's the favorite part of your job?
My favorite part of my job, when I have that one child I've worked with for several visits, and they eventually sit on a dental chair and we get everything done with no tears. That's my favorite day. We've had those ones, just take a little visit here and there until it's just like a perfect visit. In fact, it's interesting you asked me that question. I asked myself one time when I was driving home, do I really remember anything during the day that makes it uncomfortable, harder? And tell you the truth, it's like amnesia at the end of the day. It's like being a mom, You're with your children all day long. They will drive you crazy. But at the end of the day, you put them to bed, you give them a nice kiss.
Yeah.
The same way too.
And then you go and pour a glass of wine. No, I'm kidding.
There you go too.
Sometimes. Dr. June, do you have children?
No, ma'am.
Okay.
I'm blessed. Yes, no.
So you've got all your babies that you need at your practice.
I have a lot of babies.
I didn't know if you were going home to more of that or not. Some other like nitty gritty questions while I have you. I'm just curious, when it comes to products, is there like a brand of toothbrush that you recommend? Is there toothpaste that even as adults, I'm selfishly going to ask that we should be using?
So my recommendation is make sure you see that it's recommended by ADA. If it has ADA seal on it, that's a good product because, they test their product to make sure it's ADA recommended. Number 2, I know we live in a world where people are kind of anti-fluoride. There's mixed, reviews, do you use fluoride or don't use fluoride. So there's some product out there that can help for people who don't use fluoride. One of the big one is nanohydroxyapatite, which is a new product out in the market now in toothpaste. And they found like 10% of the nanohydroxyapatite is the same level as when you use, fluoride toothpaste. So if you are anti-fluoride, that's another alternative to use. But anything which you can use and brush, ADA recommended, is a good.
Okay,
yes.
That's easy. This now reminds me of another question. You know how the kids, mouthwashes are bubble gum and watermelon. So I have a 10-year-old who still wants all those, and I have a 13-year-old who's like, that's disgusting, and she wants like the minty. But it depends on their age, right? When you can transition to stronger stuff. At what age is that?
So to me, there's no problem with the flavor. I like bubblegum flavors.
Okay, so they can keep using
stuff. Yeah, it's just the way you want to feel in your mouth. And my recommendation, be careful of the product with alcohol in it, because alcohol is what makes you have that fresh, quick breath, happening. I don't recommend that with children because it can dry their mouths really quickly. Okay. So they can have, whatever flavor they want. I mean, whatever makes them happy, but just make sure there's no
It's just the alcohol is the one that makes it stronger. And then I have so many questions for you, but another question. The teenager, they see all this stuff online or social media. My daughter was like, I need to whiten my teeth. And I said, you're 13. I feel like that's unnecessary. So at what age do children, if ever, do they need to whiten their teeth? I mean, they're not drinking coffee or red wine, so.
I know. I run into the same situation all the time, especially when they're 12, 13 years old, because they're on social media. They're seeing all this thing on Instagram, especially with charcoal toothpaste. It's big out there. But unfortunately, it can remove your enamel and it will make your teeth white, but it can turn them yellow too. So you have to be careful about that. So
that's for any age. That's not just for kids. So charcoal toothpaste, this is fascinating. No charcoal toothpaste. What about the purple stuff that was all over TikTok?
Oh God, I haven't really tried it, but I always say don't use anything, especially for the young ones, until they're 16 years old. Okay. Another thing you have to remember, they're still growing. Their teeth are not matured completely. And I don't want them introducing, especially like harsh wrap or chemicals in their mouth yet, until probably at least 16 years old. Okay.
I mean, they have the rest of their lives.
I know, that's the thing.
Don't worry about it now. It's like they all want the fancy face serums and stuff. I'm like, your skin is perfect.
I know.
When you're 40, talk to me.
So I was talking to people the other day. You remember when you used to have that little pill when you were young, you would chew it to stain your teeth and you have to brush it off completely? Yeah. Well, people didn't like it until it became famous on, I think, TikTok. Somebody was using it. Now the kids love it. They think it's something fun. And I'm like, okay. I mean, brush your teeth.
You just, you need to make teeth brushing cool on TikTok, and then everyone.
I know. Put it on TikTok. It's cool.
Right. 2 minutes on TikTok, and then they'll all want to do it. Dr. June, what is the best way for someone to, find you or contact you to bring their child in for that first visit?
So you can call our office. Our office number is 843-771-2003. Or you can go online. In fact, you can schedule your appointment from your phone, from your laptop. Just go to our website, click on the book now, make an appointment, online from our Facebook page. Also, you can do that from our Instagram page, and you just pick the spot you want anytime.
Okay, I love it. Your website is knightsvillekids.com. I love your email. It's smile@knightsvillekids.com. Instagram is Knightsville Pediatric Dentist, and is Facebook the same? I'm sure you just search it. It'll pop up.
If you search me, probably if you just search me as Dr. June, you'll find
Dr. June. Well, are you a TikTok star? I think that's what we need to get you to do. Make you viral.
I've been asked to be a TikTok fan, but I think I need to ask one of my patients to help me.
Right. Have those teens film it when they're in your office.
Oh, wow. They know everything about TikTok.
I have one last question, and I'd like to ask a lot of people this as we close out, especially, busy business women like yourselves. What is your morning routine? I'm always fascinated. Are you an early riser? Do you sleep in? Do you meditate? Do you work out? Do you brush your teeth right away? Tell me. I want all the details.
So I'm an early riser.
Yeah.
I tend to be up early. I always I don't like sitting in traffic. I tend to be like, okay, it takes me about 38 minutes to get to work. So I don't like sitting in traffic. I'm an early riser. I'm also big on podcasts. I love listening to podcasts on my drive to work.
Yep.
Obviously, I brush my teeth when I wake up in the morning.
Yeah.
And one thing I usually do is I'll brush my teeth, I'll drink my coffee, and I'll brush my teeth again.
Oh, so we should. So, truth be told, I get up and have coffee, and then I brush my teeth. But I should brush
and that's good too, because I drink coffee on my way to work. So when I get to the office, I brush my teeth again.
How many times a day do you brush your teeth?
I brush my teeth, I would say probably 3 times a day.
Okay.
I would brush my
That's normal. I thought it was going to be like 15.
No. I mean, hey, if you can brush teeth 4 or 5 times a day, more power to you. But right. I brush my teeth 3 times.
Well, your teeth are beautiful. You're obviously the professional,
the expert. Thank you.
Dr. June, is there anything that I forgot to ask that you would like to add before we go?
Well, I wanted to say it's been February is National Children Dental Health Month. And we are celebrating this month. We're doing like different activity in our office. In fact, in 2 weeks, we're having a field trip for 1st graders to our office. And they're going to spend the day as a dentist. So they're going to brush their stuffed animals' teeth. They're going to take x-rays of the animals. And they're going to get some free dental goodies. So it's Children's Dental Health Month in February.
That is fantastic. I didn't tell you, but my 10-year-old, she wants to be a dentist, and she has a collection of teeth on her desk, and it creeps me out. Like play teeth. One dentist gave her like an actual dental mold where you can like pull the teeth out and it tells you what number it is. Then she has her sister's molds from her braces. Like, I don't know. She's into it. So
well, to tell her that's how it gets all started. It's kind of like an obsession, my friend.
It's so weird to me. I mean, because I was never into teeth and she loves them. So someday she aspires to be you, Dr. June. You're inspiring little minds as it is.
Thank you very much.
Yeah. Well, thank you again so much for your time. Again, your website, let's go ahead and say that again, is knightsvillekids.com if you'd like to go ahead and book that appointment. And this has been the Charleston Women Podcast with Dr. June of Knightsville Pediatric Dentistry.
Thank you very much, Erin. Have a nice evening.
Thanks for spending time with Charleston Women Podcast. Please like us and follow us on whatever platform you're using to access Charleston Women Podcast.